Good afternoon, everyone, and welcome to today's Summit Healthcare hosted webcast. The purpose of this presentation is to discuss some of the best practices and steps your organization can take to ensure a successful MEDITECH upgrade. Joining me on the line and leading today's discussion is Jeff Ford. He's the Director of Managed Services here at Summit Healthcare. He's been working in various roles in the healthcare industry for over 15 years now, with just over 4 years of experience with MEDITECH. So without further ado, I'm going to turn it over to Jeff to kick off today's presentation. Jeff?
Thanks, Christine, and hi, everybody. Today I'm going to talk to you about how to ensure a successful MEDITECH upgrade, specifically from the perspective of your interfaces. First, I'll discuss what constitutes an upgrade, what buzzwords should trigger us to remember to test our interfaces. In my time at MEDITECH and my 10 plus years at Summit, I've been a part of hundreds of these projects, and my team and I have seen the same hurdles pop up over and over again. We'll go over these common hurdles and talk about ways Summit and our clients have overcome them. After that, I'll detail a few hospitals who have recently had successful MEDITECH upgrades, from the interface perspective at least, and the aspects I think they handled particularly well, which can be replicated for you going forward. So when we say upgrades, what are we including in that basket? Anyone familiar with MEDITECH has heard all the terms listed here. There are the biggies, your platform changes, Magic to CS back in the day, or any version you're on now up to 6X. These are typically well-planned with an assigned HCIS coordinator and extra resources readily available. For these big upgrades, it's obvious to everyone that full testing is needed and buy-in is easier to get. However, all the hurdles I'm going to discuss today can also be found in your smaller upgrades. Maybe you're going from 6.1 to 6.2. Even with a priority pack top off, you're going to want to at least run a message comparison to make sure there were no changes to the interfaces and that any customs you may have had with MEDITECH were brought forward to this build. We'll go into detail on how to accomplish all of that a bit later. No matter the type of upgrade you're undergoing, the amount of things that need to get done can be overwhelming. It's a busy, hectic time with everyone running around trying to figure out what needs to get done. You've got to think about the hardware involved. Are you moving servers? Are you virtualizing? Are you taking this as an opportunity to update your operating systems? Are there changes to your screens that will break any scripts you have working? Are you taking on a new module with MEDITECH that could make some of your vendor systems obsolete? Do you have to retrain end users for new workflows? You know there's a lot going on with every upgrade. Never mind thinking about what resources you're going to use for all of this. Everyone still has their everyday job to do as well. It'll often seem like there just aren't enough hours in the day. But what needs to be stressed, and what I'm giving this talk for, is that despite all of these tasks, you can't forget about your interfaces. And here's why. Everything on the list from the previous slide, plus the hundreds of things I didn't have room for, are important. But what are we looking at if we ignore our interfaces? Integration is the lifeblood of most hospital systems. MEDITECH is just one piece of your entire solution. All of your disparate systems must talk to each other, and that's going to be done through your interfaces. If you fail to test properly, or worse, forget about your interfaces entirely, there can be dire consequences, even if you've properly handled every other piece of your upgrade flawlessly. The issue might be as obvious as connectivity downtime, but this is going to lead to delayed communication with what your end users are expecting to be real-time data. Sometimes your issue isn't that obvious. We've seen situations in the past where connectivity is up and messages are flowing properly. Everyone on both sides is given the green light and checking it off as live. But there could be an issue where results are being sent slightly differently in the new messages, or maybe some provider mnemonics have changed and not been propagated to the downstream system. If this isn't noticed for a week or two, you now have compromised and possibly missing patient data in your ancillary systems. And obviously, in the worst case scenario, a lack of proper interface testing can result in system-wide downtime. These are all the possible consequences of ignoring interface testing during any of your upgrades. So, okay, we have a good understanding of why integration is such an important part of your upgrade, and you're ready to tackle it. As a company that has been through this with our clients countless times, what are the hurdles we consistently see that we can help you avoid? Over the next few slides, I'm going to detail the most common hurdles we see. If you've gone through an upgrade recently, I'm sure you'll be silently nodding your head to most of these. I'll get all the hurdles out of the way, and then I'll discuss how we've seen sites successfully tackle each. Probably the most obvious and first thing we think about with an interface upgrade is, are there changes to the actual message format? Oftentimes, MEDITECH will utilize their platform upgrades as a chance to upgrade the version of your HL7 feeds from, say, 2.1 to 2.4. A common change here would be to your patient identifiers in PID3. Upgraded HL7 versions send more identifiers in TID3, often confusing your downstream vendors who are used to what they got before. Sometimes identifiers are changed within the messages, like maybe sending the NPI instead of the doctor mnemonic. The higher HL7 versions often add additional data and segments as well. Some of you may have experienced the query phenomena there in an upgrade where your simple ADT messages suddenly had 300 plus OBX queries sent along with them, jamming up all your downstream vendors. Any of these changes, big or small, are going to echo out to all of your receiving vendors. They're typically very specific in their specifications and are not prepared to handle these changes. Messages will start failing or data won't be showing up as you expect. Another change to the format of the messaging will have to do with any NMI customs you have with MEDITECH. Do you remember all the customs you have in place? Do you remember why you got them in the first place? During their upgrades, MEDITECH will try to streamline their interfaces so that they can get rid of their one-off customs that they have for you. And this is obviously going to be a problem for any vendors that are relying on these customs. So throughout the years, you've implemented a number of interfaces with a number of different systems. Do you remember all the details of an interface you set up with ECW 8 years ago? Probably not, and they're not going to either. And is there a test system up for you to work with any longer? Big upgrades need to really be treated like a brand new implementation. But for most of these vendors, your implementation period is over. You may have a support number, but that's not going to be enough to do all the testing and troubleshooting that will be necessary. Like I asked before, is there a test system in place? Do we need to build out a new one? Do we still have connectivity between the test networks? How are you going to engage with them without incurring huge costs? Who will be working with you on the vendor side? These are all questions someone's going to need to find an answer for every single one of your connections. Another obvious challenge faced in any hospital-wide project is resource allocation. The list of tasks to be completed is huge, and oftentimes interfaces are overlooked or saved for a scramble of activity at the very last minute. Part of this is often because who really, quote-unquote, owns your interfaces? It's typically piecemeal. Your RAD analyst might be the point of contact for your PACS interfaces. A lab analyst is tangentially in charge of your provider office integration, and maybe someone on your IT staff is responsible for the infrastructure and general monitoring. But when it comes time for the upgrade, there's no one owner to take charge and rally behind. Each department is working on their own priorities, so getting time set aside for interfaces can feel superfluous. Generating enough data to sufficiently test can feel like a full-time job, and this is for people who already have a full-time job. And once it leaves MEDITECH, who's going to confirm it got where it needs to go? That it's populating downstream vendors as it should with no matching errors. The challenge is getting everything sufficiently tested while utilizing your resources as efficiently as possible. It sounds silly and obvious, but with change comes change. You're upgrading MEDITECH because there are new features and functionality that you want to take advantage of. Some of these things are going to alter your general workflow. You may be adding modules, thus eliminating the need for some of your downstream vendors. Another thing we often see is changes to registration. This can alter the timing and frequency of your ADT messages, which is a huge aspect to try and determine early on in your testing, as almost all of your other vendors are relying on that ADT data. No matter what version of MEDITECH you're upgrading to, there's probably going to be a change in the way they're receiving orders. If you're on very old versions, your orders may be flowing directly into the lab or RAD via your interfaces. So the first change is going to be getting these orders flowing into order entry module and all that entails. If you already have your orders working in order entry and you're upgrading to Expanse, we've seen that MEDITECH is no longer offering their standard OE inbound interface. You now have to use the OE hold queue interface. So even though it's probably going to be positive, this is going to make huge changes to your workflow that aren't even going to be noticed until you've begun interface testing. If you don't find this out until shortly before go live, you can see what kind of disaster that could be. Final common hurdle we see can be the most glaring, and that's the actual go live. We've seen it happen too many times to count. Your go live is at 3 a.m. and two of your systems aren't connecting. What responses are you going to get when you call the vendor alpha hours? If you haven't set up an understanding with them, you're probably going to have to wait for business hours to get the help you need. If you're using the upgrade as an opportunity to replace old hardware, that can bring in further complications when you flip the switch to go live. VPN tunnels and firewalls need to be set up exactly as they were in the old hardware. Did somebody remember to test that? And once again, we're going to come back to the ownership question. Mission critical systems like, say, your PACS or your pharmacy dispensing, those problems are going to be found quickly and locally, most likely. But what about the immunizations interface to the state or your CCD interfaces that won't be noticed until later in the week? Who's the person in charge of confirming that those interfaces are working? All right, so we've discussed a lot of the common hurdles that you've probably seen in the past and will see on your next MEDITECH upgrade. Now comes the helpful stuff. I'm going to discuss what sites who have had the most successful upgrades tend to have in common. First up is creating a team, and by that I mean a team specific to integration. You'll want representation from each module on this team, as well as an overall project leader. The leader is going to be in charge of coordinating meeting times and pulling in resources at the proper time. What you want to avoid is bringing in resources when they're not needed and having them sitting on calls where they're just twiddling their thumbs. That's going to cause a feeling of disengagement that's going to be tough to win back later in the project. If you're utilizing Summit services, we assign our own dedicated project manager for each upgrade, understanding the size of the task at hand to help coordinate with vendors and all the people within the hospital staff. Talked a lot about resource and resource allocation. As I stressed, everyone involved in this upgrade has a full-time job that already requires all of their time. So how can we respect that time and only use resources when absolutely necessary? We can do what I refer to as pre-testing. A big chunk of what we need to discover is, are there any changes to the message formatting and the data within those messages? This can be checked before we ever even engage vendors or our internal resources for testing. We just need a message comparison tool of some kind. Summit Exchange works really well, but there are also text comparison tools you can find online that can assist with this. If you have an engine, you can go back and grab a few test messages from the old system or the last version of MEDITECH that you had. Then in your new version, register some patients with similar names, place a couple of orders, place a couple of results, and grab what generates. Then use your comparison tool to highlight the differences in those messages. Once you find the changes, you can decide how you want to address them. The simplest thing to do is to use a mapping tool within your interface engine to get the messages looking how they were pre-upgrade. But maybe you're noticing new things that you think could be helpful to your other vendors that they could take advantage of. Now that you know the changes, you're armed with the tools to talk to your vendors and see if they can utilize this new data or format. You've now spent a couple of hours of prep time and eliminated what can be weeks of back and forth communication between vendors trying to figure out why data isn't populating. This is the first step that Summit undertakes in our upgrade process. I want to stress again that with major upgrades, you really need to treat them as if you're re-implementing your interfaces from scratch. I recommend reaching out to each downstream vendor prior to code delivery and alerting them that you're going through an update. They may have a process in place already to assist you, as upgrades shouldn't really be new to them. Make sure you have an assigned point person from each vendor who will be available to you throughout the process. We want to streamline costs here, so you don't necessarily have to engage in a new contract with them, but even just having a support person who is assigned to you and is aware of the process you're going through and gives you timely responses can be enough here. Finally, share your go live date with everyone and see what their availability will be on that day. If they're part of the system that needs to be set up or you'll be forced into downtime, like your PACS or a registration system, something like that, it's highly recommended to eat that cost and get an off-hours contract in place with them, just to make sure on that night of go live you have every resource possible available to you. I want to dig into the testing process a bit more. At Summit, we look at testing in 3 phases. The first is the pre-testing, as I discussed earlier, where we're trying to address formatting issues before we use up anyone else's time. The second is unit testing. This is where we begin sending data back and forth, confirming connectivity, and that both sides are actively sending and receiving messages. We're also checking to see if there are errors on either end that can be easily solved. These 2 stages can typically be done with limited resources, just your team lead and someone who can generate some simple data. The third and final stage, the testing stage, is feature testing. Now is when we need to bring in our application owners. What I like to set up and what I recommend is having 2 or 3 one-hour-long standing testing sessions each week. So maybe like Monday, Wednesday, and Friday at 11 a.m. you block off an hour. Your leader will run all of these and be available for all of these, but will only invite the necessary parties to each session. So maybe this week on Monday, we're testing our PAC systems. So we invite our radiology team and the vendors that are involved in that. On Wednesday, your team leader was able to secure physicians' offices limited time. So we're going to invite our lab analysts and work through our orders. Inviting only the resources you need to each testing session will help limit burnout and meeting fatigue. Each module should be in charge of securing their own testing plan, with the project leader storing and tracking them. It's important not to recreate the wheel here, though. If your hospital has a good document repository, it's possible you still have the test plans from when these systems were originally implemented. If so, just use those. If not, your vendors can typically give these to you at no cost, or it's possible your engine vendor or MEDITECH has some from years of previous implementations. With the pre-testing and unit testing complete, most of the hang-ups we find in early testing should be out of the way now. This is going to allow your analysts to use their testing time most efficiently, generating as close to real data as possible and spending time going through actual workflows. You'll also want to have an official sign-off sheet with each application owner and vendor signifying that they fully tested their system and approving it for go live. The final key to success I want to discuss is having a go live action plan. This is both for the hospital-wide tasks and then a separate checklist specific to your interfaces. Summit has one that we use standardly that includes a task checklist, a full go, no-go interface list, and the contact information for all vendors and internal stakeholders involved. This list of interfaces should only include the interfaces that were approved at the previous step. The night of go live will be hectic, and this is where your interface project team leader will need to shine. I recommend setting up a dedicated conference line that is held open for the entire night. Share this number with all of your vendor contacts and internal users, and have your team lead constantly monitoring this. If something does come up, the needed parties can just hop on this available line rather than trying to book a go-to-meeting or scramble to find an open conference line on the fly. Any issues related to the interfaces should be elevated to the leader to handle and grab the appropriate resources. Along with your vendor contacts, you also want someone from your network team available specifically for interfaces. The first and most crucial step of the night of go live is going to be connectivity. So having an assigned network team member will alleviate that pain point for you. One thing I wanted to note here is that upgrades can be a positive, and not just because you're getting the latest and greatest software from MEDITECH. An upgrade is a great time to reset and audit your system. Start asking questions about why you're doing things the way you're doing them. Are there inefficiencies in your process that were a necessary evil of a Rust implementation years ago? You probably have scripts and mappings that over the years have been added onto and modified by so many different hands that they become a glass cannon. Now's a great time to break those down and rewrite them. The final thing to consider is that interfacing has come a long way since the last big update you took. It's no longer just HL7 data over a TCP/IP connection. Interface engines are incredibly powerful. They can move PDFs, connect to web services, process CCDs, the list goes on and on. Think about all your manual processes and try to envision them as interfaces. The possibilities and cost savings are endless. All right, finally, over the next 3 slides, I'd like to share with you some case studies of some that have been particularly successful with their MEDITECH upgrades and share my insights into what I think makes a difference for them. Kumi Health is located in northern Iowa. Their main campus houses a 299-bed community-owned hospital. They've been a long-time Summit client, taking advantage of our managed services and project management for years. I wanted to bring them up because they have a number of complicating circumstances that should make them a tough upgrade. They have 4 different facilities, all feeding the same interface engine, some all on the same feed, some all over 4 different feeds. They have multiple vendors wanting to receive from all facilities, some on the same port, some on different ports. All in all, they have over 150 unique interfaces, and every single one of those needs to be tested and validated every time there's an upgrade. Not only that, but many of the interfaces aren't just your standard HL7. They utilize the engine for CCD feeds, web services, state feeds. If you can think of a message type and a connectivity method, Kumi has it running through Summit Exchange. Despite all these challenges, Kumi consistently has successful MEDITECH upgrades. In my opinion, they accomplish this by excelling at planning and project management. Their vendor engagement is also top-notch. Vendors are never left in the dark, and their attendance on calls is expected. So they have this understanding with all of their vendors when they're going through an upgrade, that they're to be present on these calls and active for testing. For all their upgrades and new projects, Kumi utilizes Summit's project management as an extra tool in their belt to handle these things and coordinate all the calls between all these different vendors. Harrington Hospital is local to us here at Summit. They're just down the Mass Pike, located in Southbridge, Mass. They service more than 25 communities spread out over South Central Mass and Northeastern Connecticut. What I wanted to highlight about Harrington and what I think leads to their success in all interface projects, including upgrades, is their staff. Their leadership team does a great job of clearly outlining the goals and importance of testing. Beyond that, they understand and plan for the time that will be needed beyond the staff's regular duties to get that testing done. The other thing I noticed with Harrington that they do very well is they trust the experts. They utilize Summit outsourcing services, and they truly integrate our engineers as a full-time part of their team. Trusting Summit Engineering has really allowed them to think outside the box and come up with some really unique and interesting solutions in our time with them. And the final case study I wanted to discuss is Wilson Memorial Hospital. Wilson is a 100+ bed hospital in Sydney, Ohio. I wanted to highlight them here because they recently upgraded to Expanse, and they really embraced the attitude I discussed a few slides ago. They looked at taking on a big upgrade as an opportunity. They reevaluated their systems and workflows and looked for any inefficiencies. They found with new enhancements in MEDITECH, they were comfortable doing all of the ordering within MEDITECH itself, eliminating their need for a separate ordering system. I think it was Minute at the time, which is what they were doing previously. Wilson also had a number of scripts that were built out of necessity throughout the years, things like pre-registering patients and billing. With the time to rethink those workflows, they were able to transmit this data successfully via interfacing instead of scripts. Even the best written, most reliable scripts in the world still can't be as efficient and up-to-date as a real-time interface.
Great, thank you, Jeff. That's going to conclude today's webcast. We will be sending out a copy of the slide deck as well as a link to review the recorded session to all of the attendees on the line today. And if you have any other questions, please feel free to reach out to us at info@summit-healthcare.com. Thanks, everyone, and enjoy the rest of your day.